Let's move on. So we had our social media team actually reach out to you, the audience, I think it was last week or the week before, asking a question. I think we have a post about the post that we had there, which was, what do you, the audience, want us to discuss? And so we actually had several people type in some questions, and I want to thank Kate W, LNC, and Annette K for submitting some questions. And so I'm going to read these out because these are what they wanted to know about. So first question was, how long does it take to become a plastic surgeon? So more or less, and this answer can vary just depending on the path you take, but it's about 15 years after high school to get there. So it'd be like 4 years of high school, 4 years of college, 4 years of college, 4 years of med school, so that's 8 years. And then typically about 7 years of surgery training. I did 8 because I did an extra fellowship that I didn't necessarily have to do, but I just wanted to do it. So for me, it was about 16 years.
So you were like in your 30s when you started.
When I started
practicing.
when I started my practice, I was 35. Okay. Like when I started working for real. That's like kind of hard to think about, that you're not, until you're really doing what you're trained to do, you're 35 years old. It's pretty wild. The next question was, what is the fun parts about being a plastic surgeon? Well, for me, I went into plastic surgery because I like art. You know, to me, plastic surgery is like art and medicine blended together, and I really do enjoy that. For me, it's almost like you're creating something new.
Yeah,
and not to devalue a patient as like a piece of art, but there is an artistic side to it, and I really, really do like that. I like making something that is considered beautiful. Yeah. Or taking something that, you know, needs help and making it, you know, normal again.
Yeah.
Both of those really, really appeal to me. So that's what I like about it. And it is nice too that you work with patients that want to come see you. You know, when I was in general surgery or doing trauma surgery, like that patient doesn't want to be there with a sick gallbladder or be in a car wreck. That's the last thing they want. And that's fine. I mean, you still help them and everything, but it's kind of cool when patients come to you and they're like, I want to come see you and talk about this thing. Mm-hmm. I like that.
I have a quick question.
Yeah.
So you said you didn't start actually like practicing until you were like 35. Mm-hmm. What are you doing between that point?
So, well, there's the 4 years of...
Well, not schooling wise. Like,
okay, I mean, in between.
Like work wise.
So surgery training. So it's the residency.
Gotcha.
So you are working as a resident, but you're still considered, I don't want to say a student, but a doctor in training is probably...
Do you get paid as a resident?
You do get paid, but the pay is really, really low. Yeah. Like super low. In fact, before they started cutting the hours back, I calculated how much money I was making as an intern, and it was like $2 an hour. Like literally. Because, well, one, they don't pay you a lot. Mm-hmm. You know, my intern year, I made $30,000, I think, or maybe 29, I can't remember. But I was working 110 hours a week. And so when you calculate it out, I was like, geez, I'm getting ripped off here. But I mean, you're getting trained, you know? I mean, you're training, it's like an internship for a job where you get paid nothing or very little.
Right.
If you want to know more about it, Travis, just watch Scrubs.
Don't watch Scrubs. It's so bad.
Is it bad?
I think it's hilarious.
It's so hard for me to watch those shows because they're just so unrealistic. I mean, Scrubs is kind of funny, but you know the terrible one's Grey's Anatomy.
Oh, I've never watched that.
That's funny.
It's about surgery residents. Yeah. And I was a surgery resident when it came out. I know, I was like, this is absolute trash. Okay, next. Someone asked, what are the specialty areas that you can go into from plastic surgery? That's a cool question. I'm not sure we've ever talked about that. So there's actually quite a few. I personally did a cosmetic surgery fellowship, which those can vary. I did a breast and body cosmetic fellowship. There is facial ones, facial aesthetics. The other specialty areas are hand, which I do hand, but I'm not a specialist in hand. I didn't do extra training for hand.
What kind of surgery do people get on their hands that's like for cosmetic reasons?
It's not for cosmetics. It's more like reconstruction and fixing problems. Yeah, it's not cosmetic.
I was like,
yeah. I still do hand trauma, but I don't do as much elective hand. So for example, if you have bad arthritis in your thumb and you need your joint replaced or fixed, I just don't do that anymore because I just don't get enough of those cases to keep my skills where I want them to be. Yeah. But I do lots of the trauma, so like fixing broken bones and fixing tendons that are cut and things like that. So there's hand. Craniofacial is a big one. So craniofacial would be the doctors that do the cleft lip, cleft palate, and then the skull remolding in kids. Those are really cool surgeries. I mean, I could get privileges to go do them, you know, probably overseas. I could probably get them here, but it would take a little bit of jostling because most people that do that are fellowship trained in craniofacial.
All the time.
There is a burn fellowship. I mean, not a lot of plastic surgeons go on to do a burn fellowship, but I have seen a couple do that. That would be kind of an atypical one. And the other one that was fairly popular and I think is going to be less popular is microsurgery. Whenever the deep flaps, which we've talked about those, is like that's that reconstruction method that I think we're going to see kind of diminish because insurance are not paying as much anymore.
Okay.
These fellowships popped up in microsurgery, which is basically where you're sewing blood vessels together. Any plastic surgeon should be able to do that, and I do that still to this day, more related to hand trauma. If I see a cut artery, I'll repair it. I don't use a microscope personally. I use they're microscope glasses as opposed to like a real microscope, which that may be confusing, but it's just like a lesser version of a true microscope.
Yeah.
So that's another specialty area. So those are the main ones. How do we get the next generation interested in becoming doctors? I think that there's always going to be interest in people wanting to be doctors.
Yeah, I was like, is there a decrease in doctors?
I mean, if you ask any doctor, should you go into medicine, they're going to say no. And my feeling is if you were a student saying, I want to go to med school, if I can talk you out of it, then you shouldn't do it.
Right.
You know, the only person that should go into medicine is somebody who can have someone else stand there and tell them, don't do this, and they're just like, I'm going to do it anyway.
Yeah.
Because if you go in wishy-washy, you're going to be miserable. I mean, the life is hard. It's so stressful to get in, and it's stressful throughout med school as you're trying to compete for rank to get the specialty you want. Then it's stressful trying to get into the fellowships.
I mean, to me, I'm like, it should be stressful. You have people's lives like literally like
it's extremely stressful.
Hand.
Like
yeah.
residency is super stressful, although it's not as bad as it used to be.